I am a DNP graduate from Vanderbilt in 2013, also on faculty at Vanderbilt. I serve as the Chief Nursing Officer for HSHS St. Vincent and St. Mary's Hospitals in Green Bay, Wisconsin. And I'm going to be a moderator tonight. I'd like to start off, though, and introduce Dean Norman. Dean Norman has joined us, and she's going to share some thoughts and some reflection on her experience in nursing.
So welcome, everybody. It's good to see the number of people that are here. I see we're up to 29 so far. I know tonight, one of the things that we're going to talk about, and you've got some fabulous people here to be able to give you their journey and their impressions, is to look at the role of nurses on boards. That, you know, there is a big national movement for to have nurses on boards, whether they are not-for-profit boards, whether they are volunteer boards, or whether they are corporate boards. So I'll give you just a little bit of my journey that I was recruited to be on a publicly traded company that made therapeutic mattresses and bed frames that were used mostly in home health and long-term care. And this was a company in Greenville, South Carolina. They had always had a physician on their board, and the rest of their board members were people that represented business and finance and medical device types of things. And what they realized when they had a board opening was that it was nurses who really were making the decisions about what kind of therapeutic mattress, what kind of bed frames, and what they needed. So they decided that they wanted to have a nurse on the board. So one of the things I'd like to plant a seed is you never know what the contact is that is going to get you on a board. I was at the one-year birthday party of my grandson, and there was someone there that worked with my son, and I met him, and you know, Denny was saying, you know, mom's a nurse, and mom's at the time was associate dean at Vanderbilt School of Nursing. Well, he also happened to be the chair of the nominating committee for this particular corporate board. And it was 2 years after that particular encounter where, I mean, literally I met him at Drake's birthday party, that my son called me and said, Mom, they want to talk to you about possibly being on the board of this company. Would you be interested in being on a corporate board? And you know, my predecessor, Colleen Conway Welch, who really was the champion of trying to get nurses on boards. And I said, absolutely, I'd love to talk to them. Well, one thing led to another, and I was selected for that board. At the time, they had never had a nurse on the board. They also had never had a woman on the board. So I was a first in a lot of ways. And I served on that board for 10 years before the company was sold. But it was a time where I had the opportunity to really work with this group, not just the board members, but the leadership of the company on the value that nurses brought to looking at medical devices, looking at the types of equipment that were needed within, be it acute care, home care, or in nursing homes. So that was my first foray on boards. And then 5 years ago, I got a call from a recruiter that was recruiting for a healthcare organization. And I had been recommended by somebody who I had served on the board of Alive Hospice, which was a volunteer type of organization, not-for-profit organization. And one of their board members was contacted about this particular board. And she said, you know, I'm really not the right person, but I think you need to call Linda Norman. I know Linda Norman, and I think that's what you need. So they call me. I agreed to be interviewed. I will tell you, I had 9 interviews for this particular board that I had to interview with every single person on the board, plus some of their trustees and leaders within their organization. So sometimes in your journey to be on a board, it is not for the faint of heart. That going through 9 different interviews was a lengthy process with it. And the question, and they had never had a nurse on their board either. And this is Nemours Children's Health System that I'm on their board. They had never had a nurse on it. They did have women on their board, but they had never had a nurse. And one of the questions was, why do we need a nurse on this board? And my answer to them was, would you take a look at your financial statement and look at what is the largest expenditure that you have for this health system? Well, it's nursing service. And I said, and you need somebody who understands nursing service and what nurses can do and what you can do to decrease costs and increase quality from, and you need somebody on your board who can speak to that. And that was almost 5 years ago. So I've had a great privilege of working with that board. But I would encourage you, if you're ever asked to be on a board, to certainly investigate the organization that's asking you. Don't be on a board just to be on a board. But if this is a good fit, I really encourage you to do that. And the pathway that many people take, and I know there are people who are on this panel who are going to speak to this, is you need to be on local boards. You need to be on professional boards. You need to be on regional types of boards, so that as you then are asked to be on corporate boards or health system boards, that you can show that you have good board experience in being able to do that. So I've had a great opportunity, but I hope that many of you, and particularly with the background that all of our DNP grads have, would be fabulous people to be on different types of boards. So I'm thrilled that you are taking this topic, and that's going to be the topic, a part of Know Your Values for this time. And I look forward to what you're going to get from all of the other panelists. So if there are any questions for me, I'll take them now, and then I'm going to leave this to your august group.
Any questions for Dean Norman? All right.
All right. Well, I will say goodbye to you, and look forward to all the things that you're going to glean from this presentation. You have some big people who have done fabulous work in this particular area that can give all sorts of good advice.
Dean Norman, before you go, one question did come up. The question was, what do you look for when deciding if a company is a good match?
I think you have to look at what they're looking for one thing. You have to do a good financial analysis of that corporation or company to make sure that it is financially stable. That the last thing you want to do is to get in something that is going to go through a bankruptcy or something like that for your first foray in there. And I think you have to look at, what is going to feel right for a good match. That doing some investigation of what's the mission of that company, how well run is it, have there been issues and problems, and then who else is on the board, to make sure that what you're going to make a contribution is going to be a unique contribution.
All right.
All right. I'll see you guys later.
Thank you, Dean Norman.
You're welcome.
All right. I'd like to turn it over to Melissa Smithson. She is co-president of the Vanderbilt Alumni Association Nashville chapter. Melissa?
Hey, thank you so much, Ken. I appreciate the introduction. Like Ken said, my name is Melissa Smithson, and I am a graduate of the class of 2007. I have a degree in neuroscience, and I'm here today representing the Alumni Association and more specifically, just the local chapters, the local network chapters. I don't know how much you guys know about the Vanderbilt Alumni Association, but I'm here to welcome you and tell you all that upon graduation, you are all a part of the very vast and very active alumni network that Vanderbilt provides. And Vanderbilt, we really do believe in the Vanderbilt for life mantra, and we want you all to feel a part of that. So there are a couple ways that you can do that and stay involved. First of which is make sure that your information is updated on vuconnect.com. So that's vuconnect.com. And that's where you just want to make sure your mailing address and your email address are updated, especially since you're going to be graduating and you may have some changes. Please just make sure that information is updated so that you can receive emails and information about your local chapter. So the Vanderbilt Alumni Association has chapters all over the country and really all over the globe. We have over 50 active alumni chapters in cities all over the country, and like I said, and many international ones as well. And really what those chapters are all about is just keeping our network and our unit strong and cohesive. And we plan and organize different types of events. So there are philanthropy events and educational events and social events and athletic themed events, all sorts of different types of events for any interest, family events, networking events. And here, of course, tonight we're talking a lot about networking and how that can propel you into a board position. And to echo some of what Dean Norman said, these types of events that the local alumni chapters provide, they're always opportunities for networking. So even if it's a sports event or it's a philanthropy event, you never know what alumni will be present and how you can make connections. And again, like Dean Norman said, there's just always an opportunity. You never know who will pop up later and provide an opportunity or have an opportunity or know someone who has an opportunity. So I encourage you to get involved on vuconnect.com, make sure your information is correct, and then just get involved and come out to some events and meet your fellow alumni. Vandy alumni love nothing more than endorsing other alumni. And we want you all to feel a part of that and to take advantage of that. So if you have any questions at all about the Alumni Association or chapter events or what types of things that we do, please reach out to me or find information online about other representatives, perhaps in the cities where you'll be. We'd love to talk to you. We'd love for you to get involved. And we mostly just really want you to feel connected and a part of our network. So thank you so much for all that you all have done. And we look forward to seeing you at future events. Thanks so much.
Thanks, Melissa. So I think we'll go ahead and we'll move right into our panel this evening. So we have four this phenomenal panelists tonight, and I'm going to introduce each of them. So LaDonna Brown is class of 19, and she'll talk a little bit of, I'll give some brief introductions, and then I'll have you all introduce yourselves. How about that? We can do this on the fly, right? Gordon Gillespie has joined us, DNP class of 2015. April Caput, DNP 2013, and then Pamela Russadil. So why don't we start, I'm gonna ask each of you, what compelled you to get involved with your organization? And maybe as you do that, you can each briefly introduce yourselves and give a little more detail. We'll start with LaDonna.
Good evening, everyone. Hope you can hear me. So I'm LaDonna Brown. I'm a nurse anesthetist living and working in the Washington, D.C. area. And as we said before, I'm a DNP class of 2019 graduate of Vanderbilt. And what compelled me to join my organization, DNPs of Color, is at the time I was a DNP student and I was looking to connect with other people who looked like me and who was on a similar journey as me. I got my master's in a place where there was not a lot of individuals who looked like me. And to be honest, the journey was isolating. So for my DNP journey, I didn't want it to be the same. So I was purposefully seeking out others who was kind of in a similar situation, if that makes sense.
Thank you.
Thank you.
Gordon.
So for me, I recently served on the board of directors for the Emergency Nurses Association, which has over 50,000 members internationally. And I'd been a member of this organization for about 20 years, but what really got me onto running for the board of directors overall was one of my mentors, who is Beverly Malone. She's the CEO for the National League for Nursing. And she came up one day and just said, I expect you to run for the board. And it was just like, why would I do that? I'm doing great at the Cincinnati level, the state of Ohio level. And she's like, you need to lead change. You need to make big change, and you need to be able to transform healthcare. We need people like you to do that. And so as a result, I ran and ultimately got elected to the board. So sometimes it really is that hand tap or shove, whatever you want to call it, to get you in that right direction.
Thanks, Gordon. April.
Hi, I'm April Caput. I am an acute care nurse practitioner, a DNP graduate of 2013. I am the Associate Chief Nursing Officer for Advanced Practice at Vanderbilt Medical Center. I have been here at Vanderbilt since 2005 and have really enjoyed being able to do different things all along the way. I am now part of several internal boards, as well as local community boards, as well as state and regional boards as a result of my work here. I'm also on faculty with the School of Nursing and enjoy that very much. And then I am a member of the American Association of Nurse Practitioners and right now president-elect for this upcoming year. But how did I get involved in AANP? I actually got involved for very practical reasons. I am a cardiac and thoracic nurse practitioner. And so I went to my very first conference as a student member. And then I went to the next one as I graduated, to learn more procedures, and because they had a procedural workshop, and to attend some different courses for credit, and most importantly, pharmacology credit. So super practical reasons to get started. But I really found that I was able to network and meet a lot of different people that were involved in some of the same interests that I had. And so we started working on projects together. Later on, presented those projects. Some colleagues I met early on, I've even published with since then. And then I was very involved in advocacy. So AANP really gave good information about what was happening not only in my state, but federally, and I really wanted to be involved. And so I ran for state representative at AANP, and then from there I've just gotten more and more involved and have worked there and continued on until I became a member or member of our board of directors. So I've been on the board of directors for the last 4 or 5 years. And then, like I said, just recently ran for president-elect and looking forward for that opportunity as well.
Nice. Thank you, April. Pamela.
Okay, well, as Dr. Norman talked about, I started and with my career, I just wanted to get so involved with nursing. I was so passionate about nursing. So early on as critical care, I became a local member of the Critical Care Association of Critical Care Nurses, the Piedmont chapter in Charlotte. And from there became on the board of the American Association of Critical Care Nurses. And I too was in one of the first classes of the acute care nurse practitioner programs. So then became real active in that group and served on the board, but then sort of changed career, and you never know who you're going to meet, as Dr. Norman said, totally changed career paths and became chief nursing executive of a hospital in North Carolina. And from there, I thought, okay, AACN is great, but I probably need to get involved in another nursing organization to meet the needs of where my career path led. So I became active in the North Carolina Organization of Nursing Leadership, served on the board there, and then was elected president and president-elect. And from there, had contacts with some folks through the American Organization of Nursing Leadership, which at the time was AONE, the Association of Nurse Executives, and served on committees there, and then was on the board of directors, and then became president, and then past president and so forth. So I've been on nursing boards all of my career, you could say, and have I often say to people, I think I have gotten more from serving on boards than I've given, but I'm hoping it's a sort of even keel with that. And then it's like you stay involved even after you get off the board. I was on numerous committees, and then got asked by AONL, the board at the time, would I be the representative for the Nurses on Boards Coalition. And honestly, this has been it's just been a wonderful experience. I am currently chair of the board, and it's a group of 24 national nursing organizations, of which my colleagues here, some are on that group as well. And what we have done as a collaborative group with some strategic partners and others, from the Future of Nursing report in 2011, there was a big emphasis, as you all probably know, to get nurses in more leadership positions on boards and that kind of thing. So we had a goal to achieve 10,000 nurses on boards by 2020. So I'm happy to say that I think it was around January 16th or so that we reached that goal. So we are really moving forward, but unfortunately, with that, there's still a lag in nurses serving on not only nursing boards, but as Dr. Norman talked about, the other boards outside of the healthcare arena. So we are really working hard and have some great goals moving forward. So I'm really excited about that. But for my own career, Right now, I'm out still on the Nurses on Board Coalition, but also serve on the March of Dimes, which is a voluntary organization here in Nashville. I find that just as rewarding. And I think nurses have a role in numerous types of boards and outside of, you know, your particular career path, because I have nothing to known, not a whole lot about maternal child nursing. So serving on that board has brought forth a lot of advantages as well. So in my full-time job, I'm Chief Nursing Officer at Community Health Systems, which is, we have 80 odd hospitals in 16 states and here in Franklin, Tennessee. So happy to be part of this group as well. So thanks.
Thanks, Pam. So we've had some questions submitted, and I'm going to go through a few. So the first one is, what's the best way to express interest in serving on a board of a particular organization? Gordon, maybe if you want to give that one a...
Sure. So some organizations have formal structures. So at the Emergency Nurses Association, they talk about being committed to care. And one way that's for patients, but it's also inward towards the members. And something I would say there is if you have an interest in serving at the executive level on the board, contact a board member either by phone, email, meeting in a conference, and just say, you know, this is one of my future goals and how can I become more involved? And as you learn more about an organization, like with the ENA, what I know is that the president-elect makes all the assignments for committees on the following year. So connecting with the president-elect or other board members, they can then place you onto a national committee, which just gives you name exposure to make it more likely that you can then be on the ballot to be elected. But a lot of it really is just working with connections of others, but expressing the interest. It's definitely like contacting the people that you know that are in that role, contact your mentors, see who they have for connections, and really kind of mapping out a career plan. If you want to serve on, say, a CNO of a hospital, you need to do things to get there. It might require educational attainment, like your DNP or other doctorate. It might require knowing certain individuals, whether it's on another board. So I think a lot of it really is knowing what your destiny is and then mapping out with a good trusted mentor on how to get there, helping you to get those connections with other individuals.
Thanks, Gordon. So this is a great question, and actually one I'm very interested to hear. So LaDonna, how did you decide that there was a need for DNPs of color? How did you get started? And then is there a handbook for starting organizations?
That's actually a great question. So like I alluded to earlier, there are just a very few DNPs of color. So there's just an overall lack of diversity. And so DNPs of color, what we call docs, kind of fills that need. We actually started on social media. The executive director and I just connected in a Facebook group, and we just started exchanging ideas from there. And then we formed the actual 501c3. But our mission and vision is just to transform the landscape of nursing by increasing diversity in the DNP degree. So what we're doing is creating opportunities for engagement in academia. We're serving as mentors. We're helping with research and clinical practice. And so for me, it was a no-brainer. So I just wanted to keep doing that as I transitioned from student to now professional, full-time DNP. And I will say, no, there is no handbook. We wish there was sometimes, but there's just not. But to be fair, there is a lot of information and support out there for like nonprofits in general. So just setting up a nonprofit, setting up a 501c3, board member duties and roles, there's a lot of that. But we're such a niche organization. There's literally no other organization doing what we're doing. So we've been like literal trailblazers. So I guess you can say we're writing the handbook as we go. So we conducted a needs assessment and we sent out information to our membership. So that kind of helps guide us in our decision making. But that's just kind of how we operate at this point.
Thank you. Very fascinating. It
Yeah,
just seems like such a huge undertaking. And
it is.
Wow. April, what do you want people to know about joining AENP as members?
That's a great question. But first, I want to say I'm so impressed with LaDonna's work. This is the first I've heard of it, and just Absolutely so impressed and definitely want to support in any way I can.
Oh, thank you.
So in terms of student members, so AAMP has this acronym that we use. It's called PEARL. You've probably heard of it before, but it stands for Practice, Education, Advocacy, Research, and Leadership. And so when we talk about students, are we reaching out to students and trying to get students involved, like I was as a student, we really want to speak to each one of those elements. So practice, we have so many opportunities for learning about different therapeutic areas. We have discounts, of course, on memberships, but we also have a discounted rate for students for their board certification. So for family and emergency, adult primary care certifications, we have a discounted rate. So many students join because of that. The networking is phenomenal, and that's what I really found to be very helpful in my own practice. From an education standpoint, we have 24/7 CE Center where you can go and watch webcast. You can do self-paced courses. I mentioned the pharmacology credits. Lots of people come on for that. But we also have scholarships, and we have scholarships for master's students that are in their master's program right now, as well as doctorate students. And Ken, we actually have an application for a scholarship that students can apply for right now that actually closes on March 24th. So I thought this panel was really timely. So if you are looking for a scholarship and you're in a program now, you can apply for these. So those are some things that AAMP does from an education standpoint. Certainly the ability to get involved and present your work as you go throughout your study, especially if you're a DNP and you want to present your DNP project. This is a great platform to do it at one of our conferences, and then publish. As a student member, you can be part of, you get open access to our journals, JAMP and JNP. Advocacy was really what I was interested in. I just really felt that there were a lot of laws that were quite outdated related to nurse practitioners, as well as other APRNs. And what could I do to update those laws so we could really open access to quality and affordable patient care, and we could be out in all the communities. Certainly, I live in Tennessee, certainly in all the communities and counties across Tennessee, that we could have easily accessible and affordable healthcare for all of our residents. And so that's very important to me. Certainly federal advocacy is important. Some big things that went through that improved patient care this past year, but AAMP keeps you updated with what's going on. And so you'll be reading the, the federal affairs update and you'll be, oh my goodness, this is up for review. And so you can immediately log on and contact your legislators and being part and have a voice in what's happening and what impacts your practice. Research, tons of research opportunities. There are grants available to fund projects. I have been the recipient of a grant to fund a project that I do with my good colleague, Dr. Ruth Kleinfeld. We have a Choosing Wisely collaborative for APRNs, and the AAMP grant was what kind of compelled that. There's also a research network to where you can have access to a lot of the different surveys we do. But in terms of surveys, you can look online and see salaries, you can look for health disparities, all these different surveys that we've put out, you can have access to that data. And that is very helpful in terms of any projects you might be working on. And then the leadership portion, I had mentioned my own journey to be part of AAMP and serve as state rep and serve on the board, and now going into this next year as president-elect. But there are opportunities to lead communities. So we have different communities that could be a community for a therapeutic area. I'm a member of the acute care community, but all the different therapeutic areas, as well as communities of interest. So if you are a veteran, we have a veterans community, so different communities of interest, so that you're part of the big AAMP nurse practitioner association, and that's really a professional home for all nurse practitioners, but we do have many interests amongst ourselves. And so we can break off into these different communities and have different discussions about clinical matters, as well as just what we're doing out there. And then I mentioned earlier, being able to join up with other nurse practitioners across the country in different projects that we might be interested in. And that's really how I've gotten a lot of things done in terms of presentations and publications, has been through the many colleagues that I've met through AANP. And then certainly as you go on in AANP, you can be part of our fellows. I know that there are a few fellows that are participating tonight, and at each conference, a lot of fun going to the conference. But one of the things Vanderbilt does is they have a reception for all the fellows, and everybody can go, all the students, all the different members can go and join and celebrate with our colleagues from Vanderbilt. So that's just a little bit, actually, Ken. There are lots and lots of things. I could go on all night about all the different things and reasons to be part of AANP as a student.
Thanks. You're absolutely right. So I want to shift a little bit. So Pam, 10,128 nurses on board. I guess the question that I have, and maybe some of our attendees have here, is what do nurses and NPs bring to corporate boards? So I guess maybe it's sort of the, the kind of the so what, I guess, right?
Yeah. Well, it's interesting that you asked that, because Nurses on Boards Coalition, we have looked at this quite extensively over the years, and feel extremely strong, as is in the literature. Nurses have a special set of skills. I mean, it's an enhanced skill set that serves well on whatever type of board, and we've talked about numerous types tonight. But the leadership skills that April just referred to, someone had mentioned earlier, quality and process improvement. I don't know of any board, whatever type it is, that is not constantly looking, right? Any organization does, at how you can improve on quality and process metrics. And nurses have that in various ways. Communication. I mean, nurses are great communicators. We have to be with whatever role we play in the nursing profession. Human resources, that skill set, strategic planning, systems thinking, change theory, teamwork. We mentioned that earlier on tonight. You have to have that teamwork and collaboration skill set. Finance. Again, I go back to Dean Norman. She talked about, being sure, if you were looking at a board, to look at the finance. Well, a board, it has to depend on the members to have that skill set as well. I would like to refer the attendees tonight to an article from a colleague of mine. I think this sort of sums up some of the skill set that nurses bring to the table. You have to be willing to share that with a larger, broader base of healthcare. And Dr. Kathy Sanford, who many of you might know, or at least know the name, she's a well recognized leader in the healthcare arena. She's CNO for Common Spirit Health, which is a huge healthcare company. She just recently published in Healthcare Executive. The title of the article is Improving Engagement and Operations. And she spells out some of these leadership qualities and skill sets that's needed. So I was so impressed that was out there and in the literature outside of the nursing literature. So I think that, again, if you want some extra information, that's great to have.
Thanks, Pam. LaDonna, this question came up. What would you tell a student who's someone who's a student, is also working full-time, encouraging them to join, much less start a professional organization? Is it worth the time and effort?
Absolutely. I would just tell them to just do it. Like Nike says, just challenge yourself, because you would be surprised at what you learn, but you'll also be surprised at the value that you add. Because that's always my concern when I join these organizations, like, what do I have to add? But as you go through the process and you're at the meetings, you'd be surprised at how much knowledge you have and the value you bring to the table. So I think it's absolutely worth it. And I also think it makes you a better practitioner as well, because you learn from others. You get ideas that you can actually incorporate into your own practice. And so it helps you, I think, become better. As a DNP mentor, as I help people with their different projects, I have to go back and look up information. It sends me back to the literature. So I feel like a student sometimes, but again, it makes me a better practitioner and provider overall. So I think it's a wonderful thing.
Great, thank you. Gordon, back to Melissa was on before talking about the different VU chapters. What do you see as a benefit to non-nursing alumni to have us in their midst?
I think an advantage of that is the world's moving towards interprofessional focus. We're trying to get out of our disciplinary silos. I looked at nursing has always been out of the silo, but it's not always recognized, and nurses tend to be more quiet and reserved. And I really believe nurses need to be shouting what they do so that they're not just trying to get onto a board, they're actually being asked and solicited. And I look at like different boards I'm on, in addition to having a board such as the nursing board for professional organization, I've also served on boards for professional journals. So there's a wide variety of ways that nurses can bring voice. And I think the Nurses Boards Coalition is a great way. Definitely, if you haven't signed up, sign up. You might get an invitation from just shocking places. I was asked to submit an application to be on the Joint Commission board this past year as a nursing representative, and I wasn't selected for the slate, but it's one of those you don't know where you might get tapped. And I think when people see the value that nursing comes, we're not just looking at one aspect. I think one of the other panelists mentioned, I think, Pam, you can have expertise in finance, do quality improvement. We also look at things like total worker health, if you're a business, or just overall health and well-being. When COVID hit, I think nurses were just sought out like crazy. The challenge is life became immediately chaos for everyone last March, including myself. And when you're on a board, the board that I was on, we had to immediately look at how do we operate an international business when the corporate office shuts down. And the corporate office was not staffed by nurses, it was staffed by professionals that were experts in their field, such as education, health policy, advocacy. So how do we manage that? And so we had to look at it. We brought it back to a nursing perspective. We have a business that needs to be run, but we need to do it with compassion and caring. And how do we bring our nursing attributes and bring that into the boardroom? And that's the thing where people really need to say, you know, from a nursing perspective, this is what I think you should do. And not just say from my perspective, but from a nursing perspective, because you are representing nursing. And as other board members who are in other fields see that, when you introduce yourself as a nurse, it is a highly respected profession. They do tend to stop and listen. And so I think there's a lot of value with people that are non-nursing alumni, but it's definitely making sure them knowing that you are a nurse and leverage that for the betterment of the board that you'd be serving on.
Thanks, Gordon. LaDonna, a question came up from one of the attendees now. It said, your website states the group is needed because students of color, especially Blacks or African Americans, often feel disconnected from their peers. Said, how are you reaching out to all DNPs of color in regards to the diversity on the board?
So we are mostly using our networks within our board organization. A lot of us are connected across the country. So we just recently chose our advisory committee members. And one of the things we look for are people from not only diverse backgrounds, but other parts of the country, like the West Coast, because we noticed most of our membership was on the East Coast. So we rely heavily right now on social media and our own group networks to actually find people of color. But that is primarily how we do it at this point.
Thank you. So a question for April and Pam said, can board membership help me get a better job? How much should I stress it on my CV and when I'm interviewing?
Well, I can start out with that. And I definitely think it can assist. Is it certainly not the only thing, but I mean, just the initiative and the outside of your space to go and to serve on a board definitely has some assets. It's definitely, from my aspect, been had an impact with my career. And as I said earlier, how much it has that can assist, I don't know that that's been measured or studied or whatever. But as I said earlier, every day I feel like I have gained so much through the many years I've been in practice and in a career. And there's not been a day that having served on a board has not been of value to me in my work job. It just gives you a different perspective, and the people that you meet, the people outside of your work environment that you meet. And it's amazing to me. I don't know. I just look at my years serving on the board with American Organization of Nursing Leadership. I mean, even going out for early morning walks before the annual meeting started or whatever with a colleague, and just sharing information and getting ideas and getting thoughts. It's just invaluable. And the lifetime friendships that you develop. Gordon mentioned the compassion, and I would say that. I think that is such an added, there's just so many added benefits. So I've gone round and about, and how much it can actually assist. I think it can, but I think there's so much more to it from a personal standpoint. So thanks.
Totally agree. Serving on a board, everyone on the board has a responsibility. And so you come to the table with a responsibility. And like LaDonna said, each person there has a story to share and has a perspective. And so being on a board that's diverse, you learn everyone's perspective, and you make mutual decisions, and you learn how to negotiate, how to listen, how to navigate, how to put strategic priorities in place. And so you do make those personal connections, but you also learn how to interact professionally. So when I see a CV and someone has served on a board, I absolutely take notice. And I know we're talking to a lot of students tonight, and students can serve on boards, and their perspective is very valuable. And we have students on our conference committee. We have students that weigh in on what resources should we offer students, and students will say, we want to offer information about contract negotiations and information about networking, how that can help. So having that perspective is invaluable. So students can serve on board. So when I see a CV and someone has served on a board, I know that they've had that professional interaction, that they've had the opportunity to share their perspective and listen to other perspectives and come together for mutual decisions. So you've joined, when you've joined a board, you're all mutually responsible for something. It just brings another level to the table. I was just going to share, that's what happened in my own career, is getting out and networking and being on is really what put me on some boards. And so I remember with AANP, we had a health policy conference, and a colleague of mine went and we met with all of our federal legislators about matters that were happening that impacted Tennessee. So I got to know a few of the legislators just through that. And while we were meeting with the legislators at that current time, and still today, I was very passionate about reducing opioid misuse. And so I shared some of my thoughts about bills that were, that were being considered on a federal level, and some of my thoughts about opioid use from a nurse practitioner standpoint and misuse. From that, I got more involved through our Tennessee Nurses Association. So I got kind of out and about and known because of that interest in reducing opioid misuse and substance use disorder and addressing addiction. And so because of that, I was asked to be on the governor's board where we all came together and we put together educational competencies for higher education for addressing pain management and opioid misuse. So that was really neat. And because of being on that board and all the people I met on that board, then we went on to develop a collaborative for Tennessee, where the Tennessee Nurses Association, Medical Association, Dental Association, Veterinary Association, all those that would be interested potentially in opioid misuse, we all formed a board called One Tennessee, and that's where we put out education for prescribers. So the networking that you get on a board kind of propels you to be on the next board and the next board. So much of what Dean Norman said at the very beginning, it's all of those connections that you make. So even as a student, right now, it would be advantageous to get on a board or be part of a board.
So thanks, April. The questions are coming in hot and fast now, which is great. So what I'm hearing you say is, one of the questions was, is it important to have your DNP to serve on boards? What I'm hearing you say is it certainly doesn't hurt, but maybe isn't necessary. I mean, maybe it's not a prereq, I guess, in other words, but certainly could maybe over time lend some, further credibility to the person, maybe. Okay. April, also, what qualifications does one have to be a board president? Do any of your member organizations have mentorship for those interested in joining the board?
So I can't remember if was it you, Ken? I can't, or Gordon. Just reaching out to someone that's on the board now and indicating that you're interested, so that board member can help to mentor you along the way. I think that's key. So any student that's interested, reach out to a board member and say, how did you get to where you are? And how might I get more involved and perhaps join that board, that particular board someday. So I would say reach out to a board member and just find out what their pathway has been. With AANP, I was state representative for a couple of years, and then I went on and ran for regional director. And so I was regional director for 4 years. So you do have to be a member of the board for several years before you can go on and run for president or any of the elected officers. But yeah, it was just getting involved and asking and having mentors that supported me along the way.
Thank you. Just doing a quick time check here. We have just over 5 minutes or so. LaDonna, how can one join DNPs of Color Board of Directors? Do you have any committees that one can join?
Yes, we actually have a website. It is docdnps.org, so docdnps.org. And if anyone's interested, they can reach us by email at docdnps@gmail.com. And I can also put that in the chat as well, if that would be helpful. And we do have some committees. We have a research committee, finance committee, education committee. We have a lot of things. We're a new board. And right now I'm serving as the board treasurer. So I'm, of course, the head of the finance committee, but we are actually very new and still organizing a lot of things. So if anyone is interested, then please reach out to us, because we're always open to ideas and suggestions and things to help build our organization.
Thank you. All right. So what are some lessons learned, I guess from each of you, lessons learned serving on a board that you'd share with this group, whether positive or negative? Gordon, let's start with you.
So I will just share that my very first board meeting, it was a 3-year term, and the first board meeting involved yelling and crying. And it was an incredibly uncomfortable first meeting. And so we learned really clearly, my lesson learned was that you can always, as a board member, stand up and say, we need to move this into closed session, which means at that point, the general members are not allowed to be present. Staff members that are the senior leadership team need to exit. So only the voting board members are left, so that you can have a conversation that becomes more private. And there are some topics where if it's going to become an uncomfortable conversation with other people there, it's better to have that behind a closed door. That situation, we did get it resolved. And the nice thing is that we had a mature board enough that afterwards we did have a debriefing and we talked about professional conduct, talked about how to operate as board members. And I say by the end of my 3-year term, it was like we knew when tension was coming and we would kind of just call it out. And we were very quickly to say, like, Gordon, I think you're starting to get emotional. Maybe we should go in executive session and have a closed board meeting. And then we kind of laugh it off and be like, yeah, getting kind of like excited there, because some topics are very sensitive. And whether it was COVID, we had the presidential election happening, we had Black Lives Matter was all happening, and we all had different perspectives on how our organization should respond. And we had other external threats such as American Academy of Emergency Physicians. How do we respond to those? And those are all very sensitive topics. So I would say always come prepared with evidence to the board, having read everything. Come prepared for professional and debate. Don't hold in your opinion. Your expectation is to stand up and express your opinions with evidence, no matter how sensitive the topic is. But do it in a way that's collegial, but still getting your point across.
Thanks, Gordon. Pam.
I definitely agree with Gordon. The only thing I will add to that, and several boards that I've been on have done this, and I think it's invaluable. Just information that you get is to do a self-reflection of your own self. What have you accomplished each year, contributed to the board? What's your interactions? What could you do different if need be? What could you do? What have you done well? And then probably just as important that we've done on several that I've served on through the years is to ask other board members for feedback. Not only you self-reflect, but you get that feedback, and then that next year grow from that on both sides and you just grow as a person with that as well, not only serving on the board.
Thanks, Pam. April?
I would echo everything that's been said, and then to add, listen, learn. Getting to know everyone's perspective will really bring you to a better decision in the end. So I think, listening to understand and learn and get to know one another is very important. Establishing relationships to be a very effective board. You need to get to know each other and a relationship of trust so that you can really work together and there's no hidden agendas happening or passive aggressive or anything like that. Everybody is mutually focused on the task at hand or working towards that particular strategic priority.
Thank you. LaDonna.
Remind me of the question, I'm sorry.
The question again was, of course I closed the thing. So lessons that you've learned, positive or negative?
Lessons that I've learned as a board member is that it is a lot of work. I think, especially when you're starting a new nonprofit organization and we are considered a working board. So we're actually serving in our board roles, but we're also helping set up the organization. So don't underestimate the amount of work it takes actually to be committed to this. And also, like April said, the listening part, be willing to listen. That is an important piece. And also, just the time commitment, the listening, and, the networking. You have to be willing to put yourself out there. Like we need grant funding, we need all kinds of funding. So it just takes a lot of effort. So we've just kind of learned to be, very flexible in what we're doing. So.
Thanks, LaDonna. So we're at time. Before we go, first of all, I want to thank our panel again. You guys are absolutely phenomenal. Proud to be part of this network of VUSN folks. You guys are great. And I do want to mention, so first of all, we didn't get to all the questions tonight, and but we will have more of these sessions move forward. We will, we're planning one again for the summer because we've seen that we've gotten a lot of great feedback. So if you didn't get your question answered tonight, there'll be more opportunity move forward. I do want to also just mention to everybody, that the alumni board, we're piloting a mentoring program, and we're trying to to connect our alumni with students. If you're a student, there's a link that was in the student newsletter that went out last Tuesday, and will be in the newsletter again tomorrow. If you want to apply to be part of that, the deadline to apply is March 26th. And if you're an alumnus and you missed the emails earlier this year, we'll also give you another chance to apply in the next couple of weeks. There'll be an email going out from the alumni office. Hoping to get some good participation. We want to pilot this and try to just make some meaningful links. I think too, now that we've had a little less time together in the DNP intensives, being virtual as opposed to on campus, the thing that I've missed and that's been pointed out from my students is that whole networking piece. It's absolutely vital. And all the stories that our panelists told tonight really discuss that need for developing a good, strong network. So please take that opportunity. And with that, again, I want to thank the panel. I want to thank Sarah and Betsy, and also Matt Martin, who is our, he chaired this, the Know Your Value Committee for us. So Matt, thank you so much. And I hope everyone has a great night.
Thank you.
Thank you, Ken. Thank you, everybody. Great
Thanks, everyone.
presentation.
Thank you.